Hi everyone, my name is Morgan McKittrick, and today I will be reviewing a study that I have conducted on the evidence on erythromycin eye ointment in newborns, otherwise known as the goop on a baby's eyeballs shortly after they're born, generally in a hospital, is whenever you'll see it applied. So what we're going to cover today is first off, what current literature's findings look like around the application and the results of this eye ointment, as well as some study methods for the study that we will be carrying out. And then we'll review the results and we'll have a discussion of the research study and what we find. So what are we actually studying here? I want to start with kind of a personal story, excuse me. When I was younger, between the ages of maybe 4 and 8 or 9, every night before bed, my mom would have to put this eye goop in my eyes. And she always did it before bed because if she did it during the day, I wouldn't be able to see. I wouldn't be able to walk around without running into a wall. If I had to go to the bathroom in the middle of the night, it was a hard time. And it was because I always had goop in my eyes. It wasn't an STI like we'll get into, but I always had goop in my eyes and my eyes would stick together in the mornings. So again, she always put this ointment on my eyes at night. Come to find out now at the age of 22, this erythromycin is the antibiotic ointment that was used. So that just makes me wonder, whenever we're applying this to babies, how can they see? So they're coming out of a womb into a whole new world to their parents in many cases and can't see. At least from my experience, I couldn't. It all was a blur. Anyway, that's my own personal bias aside. I felt like I wanted to lay that out there before we get into our research and evidence-based story with all of my opinions out the window, as many as I can at least. So erythromycin antibiotic eye ointment is almost always applied to newborns, like I said, immediately following their birth. And the purpose of this, it's kind of an age-old tradition actually to apply it to their eyes, is to avoid any potential chlamydial or gonorrheal infections that can be passed to the child at birth from the birthing parent. So although this antibiotic ointment is applied most often, whether there's a known infection or not, it, like I said, more traditional, it can have several negative effects that can actually harm the baby more than supporting their overall health if you're not sure if they have an infection or not. So unnecessary treatments may not be benefiting us at all. They may actually be hurting us. So my question going into this study is, should we always be providing this erythromycin antibiotic eye ointment to babies, or should we only be giving it to specific babies who clinically need the support to fight specific strains of bacterial infections? And today we'll be looking at 3 primarily. That's chlamydia, gonorrhea, and staphylococcus, which that third one is not sexually transmitted in many cases. The first 2 are. So let's start out looking at current literature's findings and kind of what other people have seen. So most studies are finding that most normal healthy infants whose parents do not have a bacterial infection, whether that be chlamydia, gonorrhea, or staph, they experience more negative effects of this eye ointment, according to the Centers for Disease Control and Prevention. However, those infants whose birthing parent do carry those bacterial infections and they have been tested and come back positive for those infections, those can be carried through the vaginal canal, the womb, the reproductive organs, and by applying erythromycin antibiotic eye ointment to the baby's eyes shortly after birth, that can be killed off and the child is more likely to benefit from that. If left untreated in many cases, their eyes will become, like I was saying earlier, stuck, yellow, goopy. So the sexually transmitted disease gonorrhea is kind of what we'll start with. It's known to cause blindness in infants whenever it's left untreated. So by application of this antibacterial eye ointment shortly after birth, the evidence shows that by reduction of the overall amount of bacteria, good and bad, it knocks out all of the bacteria in the eye, it can often eradicate any sign of gonorrhea before very much harm can be done to the child, like I said, such as blindness. Now, it makes me think, on a side note, we're talking so much about the microbiome of the womb now, and even some parents who have had cesarean sections will still swab their vaginal canals and to share that microbiome with their baby's faces, and we're kind of eradicating that by applying this antibacterial eye ointment, which can be a good thing or a bad thing depending on how you look at it. It just makes me wonder how this would apply to more recent findings. So similarly, some evidence shows that non-sexually sexually transmitted bacterial infections like staph can also be prevented from really harming the newborn if the antibacterial ointment is applied before any symptoms begin. So if a birthing person hasn't been recently screened for any kind of infectious bacterial diseases like the 3 that we've mentioned, then it may be beneficial, studies show, to go ahead and apply the eye ointment. It's pretty inexpensive in many people's cases, especially those covered by insurance, which is generally a small price to pay, many would say, in comparison to later development of those bacterial infections that may or may not harm the child further. However, evidence on erythromycin antibiotic eye ointment is shown to have more negative effects than positive when applied to newborns who are not at risk for contracting such diseases. So if the birthing person has been tested to confirm that they do not have these infections prior to birth, then it's most likely more beneficial for them not to apply this eye ointment to their child. When it's applied to a newborn, it can actually increase the risk of pink eye, and eye irritation increases. So for a normally healthy child, once applying this eye goop, if you will, the child can actually have more issues. So therefore, when such ointment is applied without any evidence of a bacterial infection being passed from the birthing person to the child, there can be more harm than good being done. And often when this pink eye or eye irritation becomes evident, the baby is provided even more treatment for a bacterial eye infection until the test cultures come back. Just because the baby looks like their eyes are red, they have an infection, let's give them even more erythromycin. But that's just causing a chemical pink eye versus a bacterial pink eye. So we're just working backwards here and not treating the actual symptoms. We're just advancing them. So also, when erythromycin antibiotic eye ointment is applied to a newborn, blurry vision ensues. Like I was saying earlier, if I had to go to the bathroom, I couldn't find the doorknob. I put my eye ointment in before bed so that I wouldn't run into anything. And it was just miserable. I felt like I couldn't see. I felt like I had blinders on. So it makes me wonder, and actually evidence shows that by blurring this infant's already kind of blurred out eyesight shortly after birth, it's hard for them to participate in any eye gaze between the newborn and their parents. This disruption of the attachment-centered eye gaze, which is so important in those early days, attachment can suffer if that's taken away, and often those first few days can't be earned back. So let's talk about some of the methods that we are using to carry out this study. So the people who are sampling will be using a simple random sampling method to determine whether this antibiotic eye ointment is more harm than help in the newborn health, including the prevention of disease and visual attachment to parents, as well as the risk of chemical infection being caused by the attempted prevention of established or even unestablished bacterial infection. So the sample size will be sure to be 300 or greater individuals across the United States who are selected at random, again through simple random sampling. And we won't know if those people are carriers of STIs or staph until after they've all been selected. So once they've been selected, they will all be tested. So once they've all been selected, then we'll randomly assign who is giving their child the ointment and who's not, and then we will test. So some questions that we're going to ask the parents throughout the study so that we can get our results. The first question I would like to ask is, how many children have you had who have received erythromycin eye ointment shortly following their birth? And then on a scale of 1 to 10, 10 being extremely secure attachment and 1 being no attachment at all, how bonded do you feel with your child visually during the immediate 48 hours following their birth? And was the newborn providing eye movement in response to stimuli of the caregiver during those first 48 hours? Another question is, how many of your newborn children have experienced pink eye or irritation of the eye following birth after receipt of erythromycin eye ointment? And how long following birth was your newborn given erythromycin eye ointment, if that pertains to your situation? So let's talk about some of the results of this study that we can assume. If the study were carried out, I would reasonably assume that this erythromycin eye ointment would prove to be beneficial in reducing the risk of blindness from gonorrhea and potentially chlamydia when a birthing person knows that the potential transmission could take place between the birthing person and the child. If they choose to use that ointment, it will reduce the overall bacteria in the eye, and we can assume that the prophylaxis will be beneficial in preventing transmissions of STDs if the birthing person and their partners were not screened and or treated for STDs during the pregnancy, as they cannot be tested during the birthing process. So if we know that someone has an STI, or if we suspect that they could and it hasn't been proven that they do not, then it would seem to be beneficial to go ahead and apply the eye ointment. This could also be the case if a partner was sexually active with other people during the pregnancy. So even if testing did occur, it's important to be open and honest with your spouse during pregnancy. And if not, or if a positive test result was the case of STI, then the ointment may be beneficial in reducing overall bacteria in the eyes again. Such mistakes could mean that it's most effective to either use other methods or no methods to treat a healthy child's eyes if there's a low case of transmission with this eye ointment, just to prevent any cascade of interventions like we were talking about earlier with the chemical pink eye chances. I can also reasonably assume through the study that the application of this eye ointment increases the risk of chemically driven pink eye, like I was saying, or other eye irritations that will result in that cascade of interventions. And in many cases, more antibiotics are just provided as treatment. So then we're even advancing the blurred vision, which seems to reduce the ability to bond by decreasing effective eye gazes between the parent and the child. So in that case, it's more effective not to use such treatment in terms of attachment parenting in the early hours and days after a child is born. And overall, and finally, erythromycin is not fully effective at preventing any transmission of gonorrhea and chlamydia from the infant to the birthing, from the birthing person to the parent. And in cases of gonorrhea, a 20% failure rate is actually common. With that said, it may not be significantly more effective to use it as a treatment as other options, such as maybe even colostrum application over the erythromycin eye ointment. So let's kind of discuss what our findings are. Overall, my findings compare fairly similarly to the literature that we read earlier regarding erythromycin not being administered to infants with little or no risk of contracting a bacterial eye infection during and after birth. And for infants who have a probable risk or even a confirmed case of a bacterial infection during or following birth, it is beneficial to killing such bacteria, and in most cases probably should be administered. So in terms of some limitations of the study, we all have them, and I even talked about that at the beginning. The nature of an action research study design shows that I would start the study by collecting information regarding current usage of erythromycin and the outcomes from its usage. I would analyze the information and I would develop a plan to either continue using it or proceed with a different solution. And then I would collect the changes after the new plan is implemented. Then I could develop conclusions regarding the potential improvements that I tried through that last trial. And with that case study design, a qualitative cross-case analysis would be utilized. So another limitation of the action research study design is a lack of repeatability to provide repeatable results over and over, which is one of the key parts of a study, unfortunately. So it can also be difficult to distinguish between action and research throughout the study, and that can cause complications in ensuring that ample amount of both are presented in each study design. Also, limitations of a cross-case analysis is that they require smaller sample sizes, so we have to keep that as small as possible without limiting the amount of subjects that can be studied and potentially skew some of our research findings. Also, some unconscious biases that can be frequent in qualitative study designs. These limitations of the study could yield me to repeat the study multiple more times or get a good view of an overall larger sample size while benefiting from the small sample sizes in each individual study. Overall, it's apparent that this eye ointment, while almost always applied to newborns immediately following birth, especially in a hospital setting, in an effort to treat potential chlamydial and/or gonorrheal infections as well as staph infections passed from the birthing person to the child at birth, may not be the most beneficial application to newborns without a probable cause of such bacterial infections. So though this antibiotic ointment is applied most often, despite if there's a known infection or not, it can actually have some severe negative effects that can actually harm the baby more than benefit them. Therefore, medical care providers should likely not administer this eye ointment to babies who don't clinically require it to fight these specific strains of bacterial infections. These are where I found my resources. This is how I crafted my study. If you'd like to look into those, I would love to discuss them with you. And that is all I have to say about this. I showed some photos throughout my presentation. I just want to go back and review those. This is often a case of chlamydia or gonorrhea, even staph, that's left untreated. You see the yellowing around the eyes. Whereas here, you can see kind of the goopy eyes from the application of the erythromycin. So there is a nice visual difference for you, and thank you so much for watching. I haven't stopped it. Nick says, good job.